I see food, I think about food, I smell food. It makes amylase come out of my saliva glands and gastric juice come out of my stomach.
Food enters the mouth, and teeth and tongue manipulate the food to break it down and mix it with saliva. Degglutination forms a bolus and puts it down the esophagus towards the stomach. Liquefied food enters the stomach and becomes chyme, peristaltic contractions, and then pancreatic juice and gallbladder bile goes into the duodenum. Food is broken down and mostly absorbed in the small intestine. Vitamins too. In the large intestine, some more water is absorbed and feces is formed.
At first sight, upon seeing my salad, my mouth waters and it secretes amylase, and then my stomach secretes pepsin.
As the salad enters the mouth, it turns into a pretty and pink bolus, travels down the esophagus, into the stomach where pepsin is secreted. The liver and gallbladder secrete bile, the pancreas secretes lipase and cholase. The duodenum receives bile and pancreatic juices, it absorbs vitamin A, iron, the jejunum absorbs B6, the ileum B6 and C. B5 is absorbed in the small intestine. The large intestine secretes mucosa, absorbs water, the colon absorbs sodium. Cellulose is insoluble fiber and is excreted as poop.
As I'm thinking about eating this asparagus, my salivary glands secrete amylase and saliva. Gastric juices are also secreted to help prepare my body for digestion. The asparagus is ingested in the mouth. Mastication occurs to break down the asparagus into a bolus. The salivary glands secrete saliva and amylase. Deglutition helps move the bolus into the esophagus. Peristalsis occurs as the bolus travels down the esophagus and into the stomach. Turns the bolus and gastric contents into chyme. Pepsin and hydrochloric acid are secreted in the stomach to break down the proteins. The liver and the gallbladder secrete bile into the duodenum. Pancreatic juices are also secreted from the pancreas. All segments of the small intestine secrete intestinal juices and absorbs vitamins. Sodium, potassium, and water are absorbed in the colon. Cellulose, cholesterol, and other undigestibles are eliminated in the feces.
Beer is different. It's absorbed directly into the bloodstream by diffusion. A tiny bit is absorbed in the mouth and esophagus. In the stomach, 20% is directly absorbed in the bloodstream. There are special enzymes in the walls in the lining of the stomach that help with the breakdown. Do-do-do, do-do-do-do, do-do. Approximately the rest of the 80% of the alcohol is absorbed directly through the small intestines. The very little remainder is eliminated with urine, breath, and sweat.
Is that ribs I see? So good. I think my gastric juices are flowing and my amylase just wants to break it down. Yum, 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 yum. Those ribs will be ingested into my mouth. I will masticate them, break them down with amylase, deglutition, help it move my bolus down through the esophagus into the stomach. Pepsin comes in and gets secreted while it churns. Bile gets excreted through the liver and gallbladder. Trypsin and lipases and amylase will be secreted by my pancreas. The duodenum will be absorbing calcium, magnesium, and iron, jejunum, amino acids, fat, sodium, and potassium. And cholesterol will be eliminated in feces.
During the cephalic phase of the apple pie a la mode, the salivary glands secrete amylase and the stomach secretes gastric juices.
As the apple pie becomes a gold bolus, the salivary glands secrete amylase, which starts the breakdown of carbohydrates. The bolus travels down the esophagus to the stomach and secretes pepsin for protein digestion. The liver secretes bile into the duodenum to break down fats. Vitamin A and calcium are absorbed. In the ileum, calcium, B12, and B2 are absorbed. Sodium and calcium are absorbed in the colon.